Well, as we've been reporting this morning, the Prime Minister Kevin Rudd is poised to unveil major changes to funding for Australia's hospital system today. For more on this, the opposition health spokesman Peter Dutton joins us now from Canberra. Peter Dutton, good morning. I mean, we haven't seen the colour of the ink yet. We really haven't seen the policy yet, but already the opposition has problems with it.
Good morning, Virginia. Well, the government obviously had leaked a fair amount of their plan to the print press yesterday. We had a look at some of that detail, and obviously there's some other information that surfaced this morning. So whilst we'll wait for the Prime Minister for his press club speech today, what we do know is that the Prime Minister is setting up a new layer of bureaucracy, which is not going to help our doctors and nurses or our patients. And I think a lot's been made of Kevin Rudd's promise, which now goes back to 2007. It is 9 months overdue. We did expect a plan by June of last year, and we'll see what the Prime Minister's got to say today.
We had a very interesting discussion yesterday on the program about this with our representatives from the AMA, from the Nursing Federation and also from the Rural Doctors Association. Not one of them, having read the same detail that you've read so far, not one of them had a problem with what had been proposed, in particular the idea that a pay-for-performance regime be put in place and that there be a federal funding body while there's still local control of the hospitals. In principle, do you have a problem with those ideas?
Well, the case mixed funding or the case-based funding we've been arguing for with the states when we were in government. It forms the basis now of the Victorian model, which was introduced by Jeff Kennett. But what we don't believe is that a centralisation of policy-making control be based in Canberra. We just don't think that is a good idea.
Well, no, as far as I understand, it's not to be policy-making control, it's the financial control, but local decisions made at that local place.
Well, again, you've got to dig a bit below the spin of the government, Virginia, if I can put it that way. And there's been a lot in relation to health. When the advisory boards are talked about, they're talked about in an advisory capacity. They're not talked about in a decision-making capacity. Tony Abbott made an announcement a couple of weeks ago that we would introduce local boards in Queensland and New South Wales, the two most dysfunctional health systems in the country, and that we should allow local boards to make decisions that affect their local hospitals. That's not, as I read it, what the Prime Minister is promoting. We advocated in our model that you do away with a level of bureaucracy. This model put forward by the Prime Minister and what we've seen so far is based on the failed area health services in New South Wales. Now, that has been a disaster in New South Wales, and I think on health you've got to look at what Kevin Rudd actually delivers, not what he promises. At the last election he promised 36 GP super clinics. He's been able to deliver only 2 of those in 2.5 years. He promised not to touch private health insurance, yet he's used both budgets of his government to try and tear apart private health insurance. So this is a government that doesn't have a very good track record when it comes to health, and of course the insulation debacle would indicate to many Australians that Kevin Rudd doesn't have the capacity to implement these so-called grand plans.
So you would doubt, would you, that such a new proposal, as we expect to be announced today by the Prime Minister, would actually do away with those area health networks, and instead that decision-making and policy-making would be centralised in Canberra? Is that your suspicion?
Well, Virginia, if you look at the words of the obviously well-informed journalist articles yesterday, it's based on my reading on a souped-up version of the area health services as they operate in New South Wales. Now, that has been a complete disaster.
Elsewhere too, those
elsewhere, but in Victoria they have a local board model, which again was based on the Kennett reforms when Jeff Kennett was in government. But if you look at the area health services, I mean, these are the ones that have the disaster of not being able to pay the local butcher or not being able to provide even the most basic of drugs or dressings or supplies to their hospitals. They're the ones that run massively over budget. There's enormous bureaucracy, layer after layer. And Kevin Rudd's not advocating abolishing any of that. He's advocating adding to it. And that is why we just believe that health in this country is a $100 billion system. I just don't think Labor can be trusted when it comes to the management of a $100 billion health system.
What about the principle of the federal financing control of outside hospital services? Where do you stand on that one?
Well, again, Virginia, if you look at the detail, what the Prime Minister said in 2007 was that he would end the blame game and that the buck would stop with him. He's led people to believe that a single funder model, which may have some validity, but not in the form that he proposes it, actually doesn't do away with any of the blame game. He's saying that the Commonwealth will still put their portion or their share into the system, and that the states will still put their money in. He's not advocating a single funding arrangement from the Commonwealth. That's not what he's doing at all. And so the argy-bargy would still go on with who had responsibility for what. The government talks about virtue in a 50-50 or a 60-40 split, depending on who you talk to. Why is that relevant across all states and territories? Why is it at 60-40? What's the magic in the 50-50 figure? Why won't that change over time? Why will that abolish the fight that goes on between the states and the Commonwealth now? Well, the answer is that it won't. And I suspect that there's a lot of spin from the Prime Minister today, but basically I think what he's trying to do is to set himself up for a fight with New South Wales and Queensland in particular, because that will give him political advantage. And if he's seen to be fighting with the states and territories, that will somehow inoculate the fallout against the Labor administrations and their corruption in New South Wales and Queensland. He's desperately worried about how that will impact on his federal vote. And the important thing to remember as part of all of this too, Virginia, is that, that Kevin Rudd hadn't even booked into the press club until yesterday. This wasn't a planned approach. It wasn't as if this was worked out for good policy reasons, the timing of it. This was done just to knock Peter Garrett off the front page of the paper. That's why it's not good health policy.
Okay. Good to
I have to call it as it is, Virginia.
Yeah, I know.
How it is.
And a grab bag of everything that goes with it. Peter Dutton, good to have you on the program again. Thanks so much.
It's a pleasure. Thank you.
Thank you.